Hello, I'm Diana Keogh, Editor-in-Chief of ShareWIK.com. Today we're chatting with Dr. Ellen Kempf and Dr. Vincent DeGeorge of the Akron Children's Oak Adoptive Health Center about the topic of adoption. Dr. Kempf and Dr. DeGeorge have agreed to take questions that have come in off the internet from our members. Dr. DeGeorge, this woman asks, if the health history of the child is unknown, are there medical tests or agencies a parent can turn to help fill in the gaps?
In many of our international adoptions, there is oftentimes a lack of history in reference to birth parents, any genetically predisposed conditions that would relate to them. So the information that is out there just is not. And so oftentimes that information, although one would attempt to get it, is not available. And in addition to that, there really is not any specific tests that you can administer, either blood work or anything of that nature, that would be able to detect some of the genetically predisposed conditions associated with some mental health conditions.
Are there things a parent can do to help a child navigate those feelings of feeling unwanted or feeling different?
You know, I think with adoption, people adopt out of choice. So really, if you look at it a different way, they're the ultimately wanted kid. They were adopted by a family who made an active choice to choose them to be adopted. So I think if we put a different spin on it, you know, they came and joined this family out of choice, which when you think about it, that's pretty powerful. That's more than, you know, many bio kids have. You know, they were truly chosen and truly wanted by a family.
Are there specific issues that adopted children are more prone to? And is there anything that a parent can do to prevent these from happening?
We oftentimes are unsure about the genetically predisposed issues that may occur within kids. So whether they've had issues of attention deficit disorders or some prenatal exposure to drugs and or alcohol, we would highlight some of the behavioral concerns that parents would present to try to determine whether or not these are situational and in reference to maybe the blending of the kid and the family and the changes in environment versus something that may have more of a genetically predisposed condition that would influence behaviors such as concentration issues, excessively active behavior, some anxieties and depression.
What should a parent tell their child when he or she asks about their adoption or birth?
If adoption is just a word in the vocabulary that's just part of your family, there's never a time when you have to, quote, bring it up and tell them. You know, right from the beginning, it's just a word that's celebrated, and, you know, it's not forced, it's not rammed. You know, the more we keep things secret and the more we hide things, the more I think there's kind of a negative tone on it. And if we just make it part of how we grow families, the negativeness, the secretness of it just isn't there.
Dr. Kempf and Dr. DeGeorge, thank you so much for being with us here on ShareWIK.com. This has been great information. If you'd like more information about adoption, please go to our website at www.sharewik.com.